Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 25-year-old man presents with a widespread rash over his body. The torso and limbs are covered with multiple erythematous lesions less than 1 centimeter in diameter, which in parts are covered by a fine scale. You note that 2 weeks earlier he was seen with a sore throat when it was noted that he had exudative tonsillitis. Other than a history of asthma, he is normally fit and well. What is the most likely diagnosis? A. Pityriasis Rosea. B. Pityriasis versicolor. C. Syphilis. D. Discoid eczema. E. Guttate Psoriasis. Here we have a 25-year-old man coming with widespread rash over his body. The torso and limbs are covered with multiple erythematous lesions less than 1 centimeter in diameter, which in parts are covered by a fine scale. It means that the lesions are similar to the lesions of psoriasis. They are scaly. There are scaly lesions. Okay, on examination, we can see the lesions with these patterns 1 centimeter in diameter and parts are covered by fine scale. We note that 2 weeks earlier the patient has had exudative tonsillitis. It means that the patient had pharyngeal or streptococcal pharyngitis. Okay, the question is asking about the most likely diagnosis. Here we have guttate psoriasis. The diagnosis can be guttate psoriasis because of the pattern of the lesions and their history of their exudative tonsillitis 2 weeks before the lesions appear on the patient's body surface. Okay, we are going to explain it. As we said, the diagnosis is guttate psoriasis. Guttate psoriasis is a type of psoriasis characterized by small drop-like red or pink scaly lesions that suddenly appear, most often on the trunk, arms, and legs. As we said, the lesions were in the patient's body and limbs. The word guttate comes from the Latin gutta, meaning drop, because of the pattern of the psoriasis lesions. They are like as drop. We call it guttate psoriasis. Guttate psoriasis is more common in children and adolescents. This one is also important there. Pharyngeal tonsillitis, the streptococcal pharyngitis is common in this age, and we can see guttate psoriasis in this age also. It may be precipitated by a streptococcal pharyngitis, especially group A beta hemolytic, 2 weeks before the lesions appear. As we said, we have the history of streptococcal pharyngitis 2 to 4 weeks before the lesions appear. Features of guttate psoriasis: teardrop papules on the trunk and limbs. Here we can see the teardrop papules on the body surface of the patients. Some of the lesions are scaly, which means that the patient has guttate psoriasis. Management of guttate psoriasis: most cases resolve spontaneously within 2 to 3 months. There is no firm evidence to support the use of antibiotics to eradicate streptococcal infection. Topical agents for psoriasis, for example, topical corticosteroids, vitamin D analogs, or topical corta preparation can be useful. UVB phototherapy also. Tonsillectomy may be necessary for recurrent episodes of streptococcal pharyngitis. Differentiating guttate psoriasis and pityriasis rosea. There, in some cases, their lesions of guttate psoriasis are so similar to their Pityriasis rosea lesions that differentiating between these two is important. Guttate psoriasis prodrome classically preceded by a streptococcal sore throat 2 to 4 weeks, but in Pityriasis rosea Many patients report recent respiratory tract infections, but this is not common in exam question, and this one is not so important. Appearance in guttate psoriasis, we can see teardrop scaly pustules on the trunk and limbs of the patient. But in Pityriasis Rosea, we can see hair patch followed 1 to 2 weeks later by multiple erythematous, slightly raised oval lesions with a fine scale confined to the outer aspects of the lesions. May follow a characteristic distribution with the longitudinal diameters of the oval lesions running parallel to the line or longer. This may produce a fiery appearance, and this one is usually common in the back of the patient. We can see this fiery appearance. Treatment in guttate psoriasis, most cases resolve spontaneously within 2 to 3 months, but topical agents for psoriasis, as we said, for example, topical corticosteroids, topical vitamin D analogs or coal tar preparations can be helpful. Also, UVB phototherapy is helpful in treatment of psoriatic patients. But in Pityriasis Rosea, there is no need for treatment. It's self-limiting and resolves after around 6 weeks. Here we can see the lesions of Pityriasis Rosea in a patient. Okay, here was a short explanation about guttate psoriasis presentation and the differentiation between guttate psoriasis and Pityriasis Rosea. Thank you for your attention.